45-year-old man is brought to the hospital by his daughter with complaints of wide base gait. His daughter reveals that he was sitting silently in the examination chair with a blank face. In addition, he was talking to the empty chairs frequently and told his daughter that his friends were sitting there. He has been forgetting many small things recently. On physical examination, fine movements are seen at rest that disappear when he is asked to drink water. A stepwise slowness in movement in his upper limb is also seen. Which of the following is most likely to be observed in a histological? Okay, so the thing is, a lot of you told option A for this, and the correct option is D. I think a few of you answered this right. Yeah, the diagnosis is Lewy body dementia. Okay, so option A, tau protein aggregates in cortex. You have to think of like tau protein or even like these, okay, like any kind of thing, just automatically think of like Alzheimer's. Okay, don't think of anything else. Over here, they've not really mentioned anything about patient having, okay, they've mentioned that he's been forgetting many small things recently, but if you look at the bigger picture, if I would say in this question, the patient is clearly having visual hallucination, which is sort of specific for Lewy body dementia. Okay, so the patient's daughter states that he was looking at a chair, he was talking to the chair, he was telling her his friends were sitting there. So obviously you can kind of correlate that the patient is hallucinating, okay, and it's visual hallucination. In addition to that, they mentioned he has fine movements that are seen at rest and disappear when he's asked to drink water. They're pointing towards a resting tremor, okay, a tremor that is seen only at rest, disappears upon movement, okay, which is one of the features of Parkinson's, okay. A stepwise slowness in movement in his upper limb is also seen. Once again, this points towards, like I mentioned, like the TRAPS mnemonic, okay, this points towards your akinesia, bradykinesia, which is just very slow movements. So kind of correlate. The patient is having Parkinson-like features or this Parkinsonism, and he's also having visual hallucination. Bring these two together, you're going to have Lewy body dementia as a diagnosis. Okay. Lewy bodies in affected neurons. Okay. Just be careful because I've mentioned two options like that. The thing is, Lewy bodies in affected neurons is seen in Parkinson's, whereas cortical Lewy bodies is seen in Lewy body dementia. So like I mentioned, though this patient has Parkinson features, look at the bigger picture. He also has visual hallucination, which is not going to be seen in your regular Parkinson's case. So you can just rule that out as an option. Okay. Spongiform changes in the cortex. I already spoke about this Creutzfeldt-Jakob disease, okay, or any prion disease. It's not seen over here. Like I mentioned, they will definitely mention myoclonus or the rapidly progressive, mental deterioration. Okay. Once again, neurotic plaques, okay, like Alzheimer's, you can just roll it out. Okay.
Thanks for watching. Please give a thumbs up and subscribe for more.